The views and opinions expressed in The Fact Is with Hollis Grant are those of Hollis Grant and do not necessarily reflect the official policy or position of Droids Canada Network. Droids Canada Network does not take responsibility for any content or position produced by Hollis Grant and his show. Listener discretion is advised.
Good morning, good afternoon, and good evening. Thanks for tuning in to another edition of The Fact Is, and I'm your host, Hollis Grant. Today, we're talking about two situations, COVID-19 and emergency orders. As of the current time, and as of recording, there is a pandemic going on, but not the normal COVID-19 pandemic. A new quote-unquote super mutant COVID has taken a hold of the largest democracy in the world, India. The double mutant. What are the risks of India's new COVID-19 variant? This is from the BBC, dated March 25th. What is a double mutant variant? Like all viruses, the coronavirus keeps changing in small ways as it passes from one person to another. The vast majority of these mutations are inconsequential and don't alter the way the virus behaves, but some mutations trigger changes in the spike protein that the virus uses to latch onto and enter human cells. These variants could potentially be more infectious, cause more severe diseases, or evade vaccines. Vaccines against respiratory pathogens like SARS-CoV-2, the virus that causes COVID-19, protect us by stimulating our bodies to make antibodies. The best type to protect us are the neutralizing antibodies because they block the virus from being able to enter the human cells. Indian genome scientists have detected a so-called, quote, double variant, end quote, of the novel coronavirus. The government said that an analysis of the samples collected from the western state of Maharashtra showed, quote, an increase in the fraction of samples with the E484Q and L452R mutations, end quote, compared with December last year. Such double mutations confer immune escape and increased infectivity, the health ministry said in a statement. Dr. Jeremy Camel, a virologist at Louisiana State University Health Scientist Center, Sevierport, says the E484Q is similar to E484K, a mutation seen the B1351, the South African, and the P1, the Brazilian variants, which have emerged independently several times. If enough mutations happen in a viral family tree or a lineage, the virus can begin to function differently, and the lineage can become a so-called variant of concern. As far as the L452R mutation, also found in the double mutation in India, it got first attention as part of the B1427/B1429 lineage in the U.S., which is sometimes called the California variant, Dr. Camel told the author. Not at all, are double mutants rare? Not at all, Dr. Camel, who recently co-authored a study of 7 growing lineages of the novel coronavirus in the U.S. There are 7 variations going on right now, folks. 7. And now we have more double mutants coming. It's coming to Canada. To continue on with the article, quote, it is now extremely common to see more than one mutation at once, even if we limit ourselves to the spike gene, end quote. Early in the pandemic, most spike genes had only one mutation, D641G. Now that mutation is dominant and everywhere, so we see others on top of it, according to Dr. Camel. In fact, GISAID, an open sharing database, lists 43 viruses that have both the E48Q and L42R mutations found in India. Dr. Camel says a virus collected in March from England has 9 spike mutations. Quote, that's a lot of mutations. Are we sure that the Indian variant has only 2 spike mutations, he asks. Once the Indian researchers upload their data to the database, scientists from around the world will be able to determine whether or not the double mutant is the same lineage as the one found in England, or whether this combination of mutations independently emerged, as was the case for the K417N/T, E484K and the N501Y triplicate of the mutations that came together in Brazil, South Africa to give rise to their strains, P1 and B1351. How worried should we be about the new variant? Mutations in the spike gene can make the virus inherently, quote, better at infecting people, or can help the virus escape neutralizing antibodies. This means that the virus mutates in the, quote, right way. It can reinfect someone who has already recovered from COVID-19. But scientists say reinfections will be very mild compared to primary infections in people who are vaccinated or have recovered already from an earlier case of COVID-19. But if the virus can use reinfection to spread, that would be, quote, penetrating, end quote, herd immunity, says Dr. Campbell. And herd immunity happens when a large portion of the community becomes immune to a disease through vaccination or through the mass spread of the disease. This puts the most vulnerable people at risk of severe disease, since the virus can move through the herd to reach them. He says, unlike some of the other variants, India's new double variant is not likely to be more deadly or more inherently transmissible, but that more data is needed to be sure. Is the variant the reason behind India's second wave? But to answer that question, let's go back. He says, unlike some other variants, India's new double variant is not likely to be more deadly or more inherently transmissible. But more data is needed to be sure. Is the variant the reason behind India's second wave? India reported 47,262 cases and 275 deaths on Wednesday, the sharpest daily rise this year for a population of over 1.3 billion people. Dr. Rakesh Mishra, director of the Hyderabad-based Center of Cellular and Molecular Biology, told the author that the, quote, double variant has been found in 20% of the cases in Maharashtra, which has seen a huge spike in reported infections. Quote, one suspicion is that the variant is the cause of India's second wave of infections. I would say no. 80% of the samples we have sequenced don't have this combination of mutants. This mutant has been linked to only 230 cases in Maharashtra of the several thousand samples sequenced, he said. Much more worrying is the England or Kent variant, also known as B117, which is now dominant in much of Britain and has spread to more than 50 countries, a total of 736 of the 10,787 samples sequenced in India have been found positive of this variant. This variant is more likely to contribute to a, quote, intense second wave, Dr. Campbell says. According to studies, it's over 50% more transmissible and 60% more lethal, 1.6 deaths for every one death caused by the previous version of the virus. Quote, however, most likely it is going to be human behavior that drives the second wave, Dr. Campbell says. It's not the virus that's going to do it. It's humans that are going to spread this disease. Another round of COVID. Super mutant. Which brings us to an article that was today posted on the Canadian Broadcasting Corporation or the Canadian Communist Party newspaper. See our prior episode of the look into Canada's or the Liberal Party's organ, their mouthpiece, the CBC, and the union that controls the CBC, droidscanada.com, is the place to go back to listen to those prior episodes where we talk about the funding of unions that go into the CBC. But we will read CBC's article from April 21st. Canada eyes a policy on travel from India in response to massive outbreak. Now keep in mind they knew about the super mutant a month ago in March. It's crippling India, bringing it to its knees. The federal government is looking into flights arriving from India due to a massive surge of COVID-19 cases ravaging that country. Canada's top health doctor said Wednesday, as at least one province urged Ottawa to tighten the border, the government generally believes that limiting travel from specific countries can only go so far, said Dr. Theresa Tam, Canada's chief public health officer. India, she said, may present a special case. Quote, we will be doing further analysis because it's an emerging situation, not just because of the variant of interest at this point, but because they have, unfortunately, a very massive resurgence in that country, she said. Quote, we will be doing that risk assessment again and using the data that we have now collected at the border to inform our next steps, end quote. Tam said, Canada tends to take a broader approach, opting for layers of protection against travelers from all countries. She pointed to pre-boarding tests for COVID-19 tests on arrival and government-mandated quarantines. But calls are mounting for Ottawa to limit travel from India and other such hotspots. Hospitals in India are overwhelmed. India recorded nearly 300,000 new cases of COVID-19 on Wednesday alone, with 2,000 more deaths linked to the virus. Hospitals in India are now overflowing and medical oxygen is in low supply. The effort to test and vaccinate residents is floundering, and bodies are piling up at the morgues and crematoriums. But Indian Prime Minister Narendra Modi is still urging states to avoid lockdowns by creating microcontainment zones to control outbreaks instead. According to the Canadian government, 35 flights from India with at least one case of COVID-19 abroad have arrived in Canada in the last 2 weeks. 35 flights in 2 weeks with a super mutant double variant that's more infectious, more deadly, and more everything. Yet flights are still coming in. Ontario government is pleading with Ottawa to ban travel from India. The provincial government says cases of COVID-19 are pouring in through international borders. Provincial House Leader Paul Calendra said the federal Liberals must act now to prevent more variants from infiltrating Canada. I am pleading with the Prime Minister to secure our borders so we can get a control of these international variants, he said. Canada has limited travel from some countries over the course of the pandemic. In late December, the government barred flights arriving from England in a bid to prevent a contagious variant of COVID-19 that first emerged there from entering the country. The ban lasted until January. Ultimately, the B.1.1.7 variant took hold in Canada. As of Tuesday, the federal government was reporting 67,417 cases of COVID-19 involving that variant. They locked down flights from England for a month. But a super mutant double variant from India that they've known about since March is grappling the country, and they have not stopped flights from India. Why was England banned from coming into the country, but India is allowed to come in to the country? We'll hear what our fearless leader, Jagmeet Singh, Go back and listen to his episode, Droids Canada. In a tweet from April 19th, Jagmeet Singh, I have written to Justin Trudeau asking him to consider using the Federal Emergencies Act to help Ontario. This could help make sure vaccines are getting to the people who need them and help sick workers get paid when they stay home. We must do everything possible to keep people safe. His letter dated April 18th. Dear Prime Minister Trudeau, I know you share my deep concern at the escalating third wave of COVID-19. Healthcare workers and others are sounding the alarm bell, warning us that as ICUs fill up, the ability of our healthcare system to cope with the sickest of patients is at risk. Early on in the pandemic, you raised the possibility of a declaration of a public welfare emergency under the Emergencies Act. In light of the dire situation in Ontario, the question of the Emergencies Act must be revisited. I believe such a declaration applied to Ontario could help ensure a more coordinated delivery of vaccines to those who need them most, as well as enabling workers to prevent the spread by taking paid sick days and time off to get vaccinated. Canada is not yet receiving enough vaccines, and vaccines have been slow to arrive. In some places, this means that vaccines are not available to those in danger. The most glaring example of this is in the city of Toronto, where the wealthiest neighborhoods have higher rates of vaccination than neighborhoods where racialized and working class people live, and which have higher levels of COVID-19 positivity. The public health advice is clear. The virus is spreading in workplaces. Paid sick days and paid vacation leave is urgently needed. We have spoken many times of the need to make changes to the federal sickness benefit to make it more accessible, more flexible, and to offer full pay. For some workers, this is their only option. I am urging you to work with me to find solutions, including reimbursing employers who begin to provide paid sick time if necessary. Many provinces have taken steps to contain the virus and distribute vaccines to priority populations. I do not believe a declaration should apply to provinces where it is not needed. Ontario is a glaring exception. If public confidence is in the government's response to COVID-19 is further eroded, this will make it almost impossible to stop the spread of the virus. The stakes could not be higher. Doctors have called the current situation of Ontario a, quote, catastrophe. There is still time to change this course of the pandemic. There is still time to save lives, but we have to act. I encourage you to convene a meeting with opposition leaders and premiers to work together on solutions. We must come together and work as a united front against this catastrophic pandemic. There will be disagreements, but I believe we can find a way to put those aside to protect the health and lives of people across Canada. You have my commitment to work with you on this most important challenge. Jagmeet Singh did not mention about closing the borders to India, where you know that a super double mutant variant virus is coming to Canada. A super double variant mutation is crippling India, the world's largest democracy, to its knees, but yet flights still arrive on a daily basis. You pushed Mr. Singh to close and stop flights from England and supported banning English people into Canada, but yet in India you allow the super double mutant variant to come into the country. And you also push for the Emergency Act. Another prime minister that did enable those special powers, essentially, for American listeners, it is martial law. That there is a suspension. And under the orders and regulations of this, Section 8, 1, while a declaration of public welfare emergency is in effect, the governor in council may make such orders or regulations with respect to the following matters as the governor in council believes on reasonable grounds are necessary for dealing with the emergency. This act is giving the powers of a king. A, the regulation or prohibition of travel to, from, or within any specified area, where necessary for the protection of health or safety of individuals. For example, a bomb blows up in Toronto and war is declared. Emergency order goes in, and the military would quarantine off said area. Is an example of that. B, the evacuation of persons and the removal of personal property from any specified area and the making of arrangements for the adequate care and protection of the persons and property. C, the requisition, use, or disposition of property. They can take your property. Over the flu. Jagmeet Singh wants the government to have the responsibility to take your property. He wants to tell you in Canada where and where you cannot go, and wants to keep people in their cities and limit mobility. D, the authorization or direction to any person or any person of a class of persons to render essential services of a type that person or a person of that class is competent to provide, and the provision of reasonable compensation in respect to services rendered. You work for the government. You will be forced to work, and they will pay you. The government will pay you. The government will tell you how to work. You will have no choice, and they will pay you. E, the regulation of the distribution and availability of essential goods, services, and resources. Jagmeet Singh wants to stop you from buying non-essential items. Did you want a PlayStation 5? Not in Canada. Did you want to buy a magazine? Not in Canada. Did you want to read a website from a different country with a different view? My friends, not in Canada. F, the authorization and making of emergency payments. G, the establishment of an emergency shelters and hospitals at the cost of the taxpayer that are run by unions. A hospital to give more jobs to unions in order for more votes. H, the assessment of damage to any works or undertaking and the repair, replacement, or restoration thereof. The assessment of damage to the environment and the elimination of the damage, and the imposition on summary conviction of a fine not exceeding $500 or imprisonment not exceeding 6 months, or both that fine and imprisonment, or on indictment, of a fine not exceeding $5,000 or imprisonment not exceeding 5 years, or both that fine and imprisonment, for contravention of any order or regulation made under this section. Do you want to read a book? You may be faced with a 5-year, $5,000 fine for buying a book. Do you want to go to church? You want to go to synagogue? Do you want to go to a mosque? And the government says that you cannot, and they show up, and they can throw you in prison for 5 years for breaking their emergency orders. To have a politician so willingly to have these powers shows you they have no interest in anything other than absolute control. I'll read one final article. April 19th. Trudeau minister says internet censorship bill will make Canadians safer. Quote, "My job is to ensure the safety and security of the Canadian population," said the minister. An article from the Post-Millennial. Heritage Minister Stephen Guilbeault will introduce the first ever internet control bill to be tabled in Parliament within the, quote, "next couple of weeks," end quote, he revealed during a video conference. Quote, "My job is to ensure the safety and security of the Canadian population," end quote, said the minister. Guilbeault revealed that the legislation being tabled is the first step in creating a, quote, "safer environment for all people online and not just for a handful," end quote, regulating hurtful content beyond what is already covered by the criminal code, according to Blacklock's reporter. Quote, "With the legislation we will be tabling, it won't matter whether or not the company is Canadian," said Guilbeault. "It won't matter where the company is registered or where their servers are located. Once a publication is flagged, it will have to be taken down within 24 hours of having it being flagged," he said. "There are not a lot of countries that are doing that right now. I think it's going to be a really good remedy to a number of problems, but it won't solve everything," said Guilbeault. "One of the issues I've learned, looking at different models, is you shouldn't try to tackle everything from the get-go." He said that hate speech will, quote, "definitely be a part of the legislation being tabled, as well as other, quote, online harms." He also said that the bill will aid in maintaining the, quote, "social fabric of our society." Guilbeault has previously cited surveys by the Canadian Race Relations Foundation showing that 93% of Canadians, quote, "believe that online hate speech and racism are a problem," end quote, and 80%, quote, "want social media companies to be required to remove racist or hateful content within 24 hours. Guilbeault said, "The conclusions of the survey are very clear. Hate speech has no place in our society. It's time to step up against online hate. The numbers are disturbing, but they come as no surprise." He continued, "Almost half of Canadians either have experienced or seen violent or hateful content online. Canadians want us to act, and that's exactly why we intend to introduce legislation. Our approach will require online platforms to eliminate illegal content such as hate speech, terrorist, violent extremism, child pornography, and the non-consensual sharing of intimate online image. Anything that you say that will criticize the government could also fall under that as well. When we have information that's coming out from all over the world. We have access to read it. And the government wants to, one, enact emergency orders to tell you what you can and can't do, and two, restrict what you can and cannot view, because not many countries in the world do this. There are a few countries that limit what you can and can't read. China, Saudi Arabia, Iran, Afghanistan, Algeria, Morocco, Syria, Cuba. Should we keep going with the countries that have dictatorships? Because online censorship is not found in places with open, free, democratic societies. So why is it that Canadian politicians, one, want to enact emergency powers to take your property, jail you, fine you for going out of your house and buying items, and two, to stop you reading things on the internet that may have a different opinion than what the government wants you to think. We have more to say in a later episode of thought crimes, of hate speech, and looking into what is hate speech in further episodes. Thank you again for listening to another edition of The Fact Is. I am your host, Hollis Grant. You have yourself a wonderful week. We'll see you next week.